Thank you, Mr. Chairman. And first, I'd like to express my deepest sympathies to all Americans who have lost loved ones to COVID-19 and to our witnesses who have lost loved ones. As lawmakers, we have an obligation to ensure that seniors are protected and cared for, whether they live in nursing homes, assisted living facilities, independent housing, or reside with their families. The Biden administration has been working hard to fix a desperately broken nursing home system. I was a state legislator, and we worked to try to help the nursing home system as well. And I don't know what the answer ultimately is, but it definitely has to be investing in our seniors. Prior to the pandemic, Government Accountability Office reported that the nursing home industry had been failing to maintain basic infection control standards like hand washing or wearing masks, even before the pandemic. Seniors fared no better when the coronavirus flooded into their nursing homes from outside communities. Likewise, reeling from the same failures of the previous administration to deliver timely or even usable PPE testing kits and vaccines. Dr. Grabowski, how could the federal government have better supported states and nursing homes early in the pandemic?
Once again, states and particular nursing homes really struggled to acquire personal protective equipment, really struggled to get rapid testing. There was a role there for the government to fill that gap. Once again, when you put nursing homes in a market where they're competing with all these other entities, they weren't in the front of the line where they should have been. They were pushed to the back of the line. They ultimately ended up getting faulty PPE. There were gaps in sort of coverage across facilities. It was a complete debacle. So this is not an area, when it comes to the lives of our older adults, that we should just let the market work this out. We should. There was a role there for governments to help the state and the nursing homes.
Okay. And because of the American Rescue Plan and the most successful vaccine campaign in the history of this country, the rate of deaths among nursing home residents fell from nearly 2 deaths per 100 residents in January 2021 to a low of 0.03 in July 2021. Doctor, in that time frame, how did you see the federal government apply lessons learned from earlier in the pandemic to ensure that past mistakes were not repeated?
Absolutely. There's a role for the federal government here. It's not sitting on the sidelines or pushing the problem down to states and nursing homes. It's actually engaging with them, and we saw that with the mandate, for example, for booster vaccines for our workers in nursing homes. That was an incredible success, and I think we've hopefully we'll continue to see that kind of engagement and centralized role for the administration going forward.
Okay. And this administration also has expanded inspection activities and targeted more aggressive enforcement measures for high-risk nursing facilities, supported good-paying nursing home jobs and training, increased industry transparency and accountability. And for the first time in nearly 40 years, the Biden administration will soon update federal staffing standards to ensure higher quality care for nursing home residents. Doctor, again for you, how do these steps move the ball forward on addressing systemic problems in nursing home care that have been ignored for far too long?
Yeah, all three are incredibly important. Let me go in reverse order. The staffing, we have far too few staff in our buildings. This was true pre-pandemic. It's been true during the pandemic. Staffing is central to good quality nursing home care and good quality of life. We need more staff in this sector. So the minimum staffing standard is a great start there. Once again, in terms of transparency, we want to know who owns these buildings and what they're doing with our money. Those are great steps. And then regulation. We need to invest in oversight and enforcement. As you said, that was declining under the prior administration. That's actually been turned around here. And I actually think we need to address some of the gaps right now in funding for state survey agencies. I think that's a real area of priority going forward.
Okay, and then just one question that affects my home state of North Carolina. Would Medicaid expansion help with funding our nursing homes?
So I'm also from North Carolina, and So this would help for the non-elderly, but not for
Yes.
the older adults. So we have shown that in our research that expanding Medicaid did lead to better long-term care for non-elderly Medicaid recipients. Thanks.
Thank you very much, and I yield back.